for this. Oh, thank you. For this network. And I think what's important to recognize when you have funding for networks is it's very different from funding for other regular research projects. So here we can only pay for networking tools. So things like meetings, like training schools, like student visits to other institutions, things like that. So we can't use it to buy to hire personnel, or we can't use it to buy, equipment for any specialized research we'd like to do. And you've already met Ingrid, and you know myself as well. And as I said, Ingrid will come back later this afternoon to meet all of you again. So what is a cost action? So it's different from regular types of research projects in several ways, in that it's a bottom-up science and technology network. And it's a open network, open to international collaboration and cooperation. So here, once the OmegaNet network was approved and set in place, it's open to researchers in Europe and also internationally for them to join. So researchers in, say, any European country could, indicate that they were interested to join the network, and there is a short registration process, and then you become a network member. And once a year, there are calls for researchers to submit proposals to host networks, just like OmegaNet. And they are based on principles of excellence and inclusiveness. And there's a lot of emphasis in cost actions to ensure inclusiveness in many ways. For example, to ensure appropriate gender balance in terms of network participants and also among the network leadership, also in terms of countries. And they want to ensure that there's a fair distribution of participation across all of the countries in Europe. And also there's a lot of emphasis on promoting early career researchers and students in the networks as well. So there have been a couple other previous similar coordination efforts in Europe. Maybe some of you are familiar with these. There was a ModernNet cost action, which occurred between 2010 and 2014. Although they're still active and ongoing, despite the official end of the network, and also the STANDERM network, which is on, this one was on occupational skin disease prevention and management. And just to say that these networks have been very successful and have had a lot of major outputs coming out of them. This is an important paper that came out of the ModernNet cost action. And so here what they did is they put together a paper comparing incidence rates in different occupational diseases between different countries in Europe. So they looked at the trends in these occupational diseases from the year 2000 to 2012. And this was such a major contribution to the literature that it actually won an award in the 2016 EPICO conference as one of the best papers in occupation and health of that year. So very important, major contributions coming out of these networks. So the OmegaNet network is formed of over 150 participants from 40 countries, and we're divided into 4 different working groups that I'll briefly highlight. The participants come from 33 cost countries. So these are European countries or cost cooperating states. And there's also near neighbor countries, international partner countries, and international organizations. And some of you here in the course are from some of these near neighbor countries or international partner countries. And we had some students join us on Tuesday, also from IARC. So the cost action is organized around a memorandum of understanding, which is basically just the proposal that you submit to cost to tell them what you'd like to do. And this document is freely available online. So we had 2 main types of objectives for the network. The first major type of objective was around research coordination. And so we wanted to coordinate occupational cohorts in Europe. We wanted to also implement online interactive tools. So all of you are familiar already with the inventory of occupational cohorts, which was the basis of exercise 2 for the class. We also wanted to facilitate work on harmonizing occupational exposure and outcome information. So you recall the presentation by Irina when she was presenting her work on occupational burnout and how it was important to facilitate standardization of the definition of burnout going forward in research studies, and also to promote stakeholder engagement from the start of the project. So we're networking with different occupational institutions in Europe. And there's also a very big capacity building component to the network as well, including this training school, which is an important objective of the network. We want to also connect scientific communities in occupational health in Europe and provide networking and leadership opportunities for early career investigators and researchers from cost inclusiveness target countries, and provide training, both in terms of training schools, just like this one, but also in terms of researcher visits and mobility for students in Europe. So these are the 4 working groups that OmegaNet is divided into. And I'll just go through each of these working groups now. So the first working group is on the inventory of occupational cohorts. And you've met Manolis, and he's the leader of this working group, along with Vivi Slunsen from Denmark. So this working group has many members. It has maybe 30 or 40 members of the group from different countries that have all been working together over the past 3 years to build the inventory that you used in your exercise. And the inventory of occupational cohort studies was inspired by earlier work in birth cohorts. I don't know is anybody familiar with this inventory of birth cohorts? And please just raise your hand if you're familiar with this inventory. No, I see a few X's. So it doesn't look like many people online here today are familiar with this inventory, but this inventory started quite some time ago, maybe about 10 years ago or so, if I'm not wrong. And for the same reasons, that they realized that there were many different birth cohorts in Europe, and that you know, a major starting place for collaboration is the development of an online inventory. You know, one place where everybody can log in and see all of the details about all of the existing birth cohort studies. So this website, it's online. You can check it out. It's built in a very similar way to the inventory that you used in exercise 2. You can search all the cohorts in the inventory here. And if you are interested to log in and register your own birth cohort, you can do so here. And so just like the OmegaNet inventory here, you can search the birth cohort inventory in different ways, either viewing the whole inventory or searching by different criteria or by region or keyword. So this birth cohort inventory was a very strong inspiration for the inventory of occupational cohorts. And I believe that Manolis also participated in the birth cohort inventory as it was being developed. And so you've all gone to our occupational cohorts inventory website, and you've all searched for cohort studies and selected 3 studies that you would like to use in a type of funding proposal for the exercise. And so I hope that you've enjoyed this exercise, and I hope it was useful for you to see all the cohorts in the inventory. And if you know of any other cohorts from your countries that are not currently in the inventory, please feel free to register and log in and register any new cohorts that you like. So some people ask us, you know, if they register their cohort, is there, you know, does it imply participation in any future projects or in future analyses? And it does not. It's so just an inventory so that people can find your cohort, and then any other research that may evolve from participating in the inventory, the decisions are taken by the cohort PIs at that time. So currently we have more than 140 cohorts registered in the inventory with more than 22 million persons in the cohorts, but this is really an underestimation because some of the cohorts, actually this field is missing. So I think it's actually much more higher than this. So which cohorts are included in the inventory? So here we don't want to inventory all of the occupational cohorts that have ever existed. We only want to inventory cohorts that are active or potentially active, because the purpose of the inventory is to stimulate future research. And any type of cohort is welcome to register in the inventory as long as they have some information on occupation or industry. They should have at least one follow-up, either already conducted or planned. And this inventory is not limited to European cohorts. So although we started in Europe, and many of the cohorts are from Europe, we're actively working now to extend the inventory to non-European regions. And over the next few weeks, actually, we're going to put a lot of work with some different students into recruiting cohorts in Asia and in Latin America and in other continents. And so this is the current, maybe some of you saw this when you were looking at the inventory last week. So this is the distribution of countries currently in the inventory. So you can see that there are a lot of cohorts. So over 10 cohorts from Australia. We have very strong partners in Australia, in Italy, Netherlands, Norway, Sweden, United Kingdom, and United States have entered many cohorts in the inventory. And there are a smaller number of cohorts from other countries, including Spain. But we hope to continue to develop the inventory. And my own goal, I hope we can reach over 200 cohorts over the next few months or so. And so as many of you saw, that cohorts can log in and register and enter their information in the online form. And this is what the source population looks like for the 140 cohorts currently in the inventory. So you can see that there are actually quite a large number of general population cohorts in the inventory that do have some sort of occupational information, maybe a job title, maybe a job title at the current time, or even a lifetime occupational history as part of the cohorts. There's also other industry or occupation-based cohorts that are based in hospital settings, as well as mother-child or generation cohorts as well. And there is some overlap. There's some cohorts that appear both in the birth cohorts inventory and also the OmegaNet inventory to ensure that they reach both audiences. These are the occupational exposures that are covered by the cohorts in the inventory. So you can see it's very broad, covers many different types of occupational exposures, ranging from chemicals and metals and pesticides to ergonomics, psychosocial domains, working time. So a very broad capture and hopefully useful for many different types of occupational health researchers. In terms of how the follow-up is conducted in the cohorts, it's done different ways. Some cohorts use biomarkers for follow-up. Other cohorts use clinical information, maybe things like lung function, measurements. Some cohorts use death certificates. Some cohorts are based on questionnaire or self-reported follow-up, and others are registry-based, like the cohorts that Ingrid presented to us a few weeks ago. In terms of the biological samples, it looks like most of the cohorts, or the cohorts that reported taking biological samples, most of them reported having information on or taken a blood sample. There's also cohorts that have taken hair samples, nail samples, and other types of samples. And so how will the information collected for the inventory be used? So as you saw, the information in the inventory is currently in this online searchable database, and it only contains the metadata for the cohort. So it does not contain the actual cohort data. So if you're interested in accessing the data from the cohort, then it'd be important to contact the principal investigator from that cohort. You can search the inventory for different topics, for different exposures, for different outcomes that you're interested in. And you can search it in this way. I think most of you have already seen this and you've already done this. And you can search for different types of exposures or health outcomes or biological samples. Or if you'd like to search for all the cohorts that are entered by your country, you can do so here. And so why do we need an inventory? So maybe I'll pause for a moment. And since most of you are very familiar with the inventory, and we've already used it to put together a type of funding proposal for the exercise, it'd be nice to hear your thoughts from all of you in terms of, do you think that this type of inventory is useful for occupational researchers? Do you think it's useful for things like planning new studies or writing funding proposals? So I'd be curious to hear from you now in terms of your experience with using the inventory and if you think this type of tool is useful for your own work or for the work of your collaborators. Erdem.
Okay, I think it's useful to seeing both most of the cohorts in a website would be useful, I believe, because if otherwise you need to look for other databases, maybe you look for PubMed or other kind of registries, but knowing that the occupational cohorts are collected in a specific web page would be useful, especially who are interested in writing a systematic review, meta-analysis, kind of thing like this. And that will be a basis for interaction and communication, I believe. Thank you.
Good. Yeah, I certainly hope so. I hope that it makes searching for cohorts and searching for partners and projects much more efficient. Anybody else? Any other comments on the inventory, or if you think this is a tool that you might use in your own research going forward? I see in the chat, Leah, would you like to please feel free to turn on your microphone and.
Yeah, I just, can you see me? Hear me?
I can hear you, thanks, yeah.
Okay, good. I just thought when planning a project, it's always good to know whether somebody else have done what you want to do already. So with the inventory, you can get an overview very quickly if the cohort you wish to create already exists.
Yes, definitely. There are a lot of cohorts out there with a lot of information that's not being used. And so hopefully this will inspire people to use this existing information that exists in many countries. Any other comments from anyone else?
Yeah, I was just going to say that pooling for rare exposures across multiple studies, I think that's something that's very useful, and or using more occupationally based cohorts to help inform general population cohorts. You can sort of combine data in different ways that you can't necessarily do sometimes in all the same study design. So it's really cool that way.
Yeah, and I think that's a good introduction to some of the topics that Neil is going to talk about later this afternoon too, in terms of, using data from slightly different sources of data to inform decision making, on a hypothesis. So good. No, thank you for all your feedback. So why do you need an inventory? As we said, there are many cohorts that exist, and something that wasn't mentioned yet is that in some cases, these cohorts have a lot of information, and it may not all be published. So there may not be information in terms of all of the types of variables that are collected in a cohort available in the same way that they're available in the inventory. And so we hope that it will be used going forward to stimulate new studies on occupation and health and new collaborations. And so in terms of the next steps, as I already said, we're planning to continue to develop the inventory. It's also possible, we just added a new feature where if you already entered your cohort into the inventory, we've added a new feature now where you can go back and you can edit that information. So if something changes in your protocol, or you added a new follow-up or a new questionnaire, you can register that if you wish. And then we're working also to promote the inventory. And the inventory is also part of the EPFOR project that was mentioned earlier, that was mentioned last week as well. It'll be part of it's part of the EPFOR toolbox, which is the Exposome project on occupation and health. So there's already one editorial that was published last year, when it was published just around the time where we started to invite cohorts to enter their cohorts into the inventory. So that was one method we used to invite cohorts to go to the website and register their cohort. And then, so that was working group 1, and working group 2 focuses on harmonizing occupational exposure and outcome information. It's led by Roel in Netherlands and Merete in Norway. And so just like how we have an inventory of occupational cohort studies, there's also a second inventory on occupational exposure tools. And I don't know if any of you, I think it was mentioned very briefly on the first day, but I'm not sure if any of you have had time to look at this second inventory of occupational exposure tools. Has anyone tried to go to that website? No. Oh, and Susan also mentioned this in her talk as well. She was also very important to lead the development of this inventory. So if you're interested in things like, if you're interested to see, is there a GEM, a job exposure matrix on the topic that you're working on? You can go to this inventory and search for all of the job exposure matrices that are entered, and see if maybe there's something that might be useful for your own work. There's also information on other types of databases, although I think right now the focus is mainly on job exposure matrices. So you can search the inventory in the same way. You can search by different tools, and you can also search by country and by exposure type. And and so there's about 39 job exposure matrices currently in the inventory, 25 different coding systems, 3 different crosswalks to go between these coding systems and other types of measurement databases. So if any of you are working with other job exposure matrices, or you're currently working to develop an exposure measurement database, please feel free to check out this other inventory, or enter the information about your tool in the inventory as well. And in terms of in terms of thinking about future funding proposals or future projects that you'd like to put together, this type of inventory on exposure tools may also be useful in addition to the cohort inventory. And so you've already seen Irina in the course. This is just one slide from her. Just highlighting all of the work that her task has done on defining occupational burnout. And she led a nice discussion in terms of, how people see burnout and how it's defined in very different ways in different countries. And this is her review and harmonized definition of occupational burnout from a large number of working group members in 29 countries. So hopefully this will be useful for your work and for future studies, to use the harmonized definitions to be able to compare between studies. There was also some work done on harmonizing diagnostic criteria for other topics, including musculoskeletal disorders. So this is one paper that's been published so far from the musculoskeletal working group. And here they looked at different case definitions for musculoskeletal disorders in different countries. And then in terms of working group 3, here they were focused on producing protocols for new occupational data collection on a wide range of topics here. And you met Tom Lonely as part of the course, and he was involved in this task on occupational skin diseases, where they've done a lot of work on UV and cancer. And so this is one of the readings that Tom provided for the course, where they were looking at, and as part of Tom's lecture, he was describing how they summarized the evidence on occupational sun exposure and these cancers worldwide. There's also been work done in another working group looking at precarious employment, and they've put together a framework for research on this topic. It may be useful to some people in this class. There's also a task looking at the birth cohorts, and they've put together a nice paper summarizing all of the occupational information available in the birth cohorts from that previous birth cohorts inventory online. And then the fourth working group was about science communications, dissemination, and training. And you know Neil already, and you know Lex. And so Lex is responsible for the stakeholder engagement, and Neil for the training. And so this is our third training course in OmegaNet. We had our first training course in Florence in 2018. And then a second training course on occupational exposure assessment in 2019 in Denmark. And this is our first ever online training course. We had hoped it would be in person, but that was not possible. But hopefully next year, if we're able to do another training course, we hope that it'll be able to be in person. Let's see. All of the videos for this training course are already up on our YouTube channel. So you're welcome to review the videos, or you're welcome to share them with anyone you like. They're just really open. And they've also just been linked to the OmegaNet website as well, so you can find them through our website. So we hope this is useful. We had a lot of participants that had wanted to participate in the course that were unable to due to the size restrictions, and so we know that a lot of them have already viewed these videos, and we get a lot of requests and inquiries about the training course, and so hopefully these videos will be useful to them as well. Short-term scientific missions. So on day one, we advertised how we have funding that students and early career researchers can go in person from anywhere from 5 to 90 days to visit another European institution in a cost near neighbor or international partner country to build collaborations and build new projects. And so these are still available on our website. They'll be available through April next year. So please feel free to take a look, and if you're interested, to apply. We've also, as part of OmegaNet, had many different meetings, first in person and then online, for all of the entire network. So over 100 people together to get together and to plan the work and to network and to get to know each other between all of the participants in all of the different countries. And the minutes and the slides from all of these meetings are also online on our website. With COVID, it kind of inspired us to start an online webinar series. So we've had about, I think, 5 different webinars so far. We plan to have more. We'll have other webinars in November and December. And they've been held on different topics. And again, these were all recorded and they're all available on our website. In case you're interested to view them. There's webinars on topics like exposure assessment, on COVID-19, and also on night shift work as well, in case any of you are interested. And then due to COVID-19, we started also a COVID-19 task group. We wanted to try to do, to try to work together and to produce useful tools for researchers working in COVID-19. And so the task group, which developed very quickly from the action, developed standardized questionnaires for researchers. I'll present it shortly, but these questionnaires are available on our website and you can download them. And they've been downloaded hundreds and hundreds of times so that if researchers would like to implement the questionnaires in their studies or in their cohorts, they can. They're freely available. You heard on Tuesday about the COVID-19 gem from Susan Peters, which will also be placed on our website very shortly. And anyone's welcome to download it and use it in their study. And there was also a third subtask that looked at how COVID-19 was diagnosed and considered as an occupational disease or not in Europe, and how COVID-19 was considered by the different occupational bodies in different countries. And so they did a survey among key occupational researchers in many countries in Europe. So this is the COVID-19 questionnaire resource. It was developed by this group of people with input from many people as well that can't all be listed here. And so they developed this questionnaire, which was intended to be used broadly in many different settings in many different countries. As I said, it'll be freely available. There are two versions of the questionnaire. There's a short version and a long version. So if you're only able to ask, your study participants a very small number of questions, you can use the short version. But if you're more flexible, there's also a longer version that you can download as well. And it covers a wide range of different domains. So this is just a screenshot of one part of the questionnaire that asks about, do you use any personal protective equipment during your work? And these are the different options and that are provided in this questionnaire. Also questions about, work-related COVID-19 as well. There are questions about financial effects and other work-based factors, but there's quite a lot of detail and quite a lot of questionnaires online. So I encourage you to please feel free to visit that part of the website and download the questionnaires or share them with anyone who you think might be interested in using them. So how can you participate? So there are different ways to participate. You can complete a short-term scientific mission, as I mentioned. There's also the virtual short-term scientific missions as well, which you can, it's basically it's the same idea, although they're conducted online. And so there's no actual travel to another institution. You can do it fully online. And there's funding for that as well. The task and working groups are also open. And so if you're interested to join one, you're welcome to do so by contacting the task leaders. So some tasks, some working groups are coming to a close and their work is completed. Others are still very active and ongoing. You're welcome to disseminate, help us disseminate any information about our work. And we hope to have another training school next year. And there are also ITC conference grants. So for all of you who are from, there's about maybe 15 to 20 what COST defines as inclusiveness target countries. And if you're a researcher from those countries, you can apply to us for a grant to help to pay for your conference registration. So for example, if you're planning on attending the EPICO conference, which is being held in a few weeks, and you work in one of the ITC countries, please feel free to send us an application and we can review that and provide funding to attend any kind of relevant occupational conference event. And then the last way to participate as well, I wanted to point this out. In a couple weeks, so from October 20th and October 21st, we're having our annual working group and management committee meeting. And you're welcome to join any part of that meeting. If you'd like, just let me know. It's an open meeting, but what might be most interesting probably to most of you is that we're having an early researcher session on day 1. So on October 20th at 3 o'clock, we'll have a session where, again, there'll be things like short presentations from students, just like the ones you've already done in the course. So if you'd like to make your presentation, again, to a wider audience, you're welcome to do so. There'll also be networking events, a mix of kind of presentations and networking during that session. And so Karina from STAMI, she works with Ingrid. She is organizing that session. So please feel free to write to Karina if you'd like to join that session. And if you'd like to make an oral presentation, let her know. If you forget who you're supposed to write to, or just please, you're welcome to write to me or Ingrid as well. And we'd welcome all of you to join us for that session. So key points. So OmegaNet is a network focusing on occupation and cohorts that are occupational, but also population-based at the European and international level. We hope that with all of this work, we've facilitated work on harmonizing occupational exposures and outcomes, and also hopefully will have led to new research projects on occupation and health, and hopefully new collaborations will exist that would not have existed before. We hope, and there are many opportunities for participation. And these are just 3 photos of some of our meetings. So they're a lot of fun, and we miss seeing everybody in person for sure. So that was my last slide. I'll stop sharing. And I see a question in the chat there. Let's see. So the